With winter approaching, it's important to be mindful of where you step when walking in icy conditions. Today, we are speaking with Dr. Sharma, who has clinical interests in bone health and osteoporosis. Hello, Dr. Sharma. Thank you so much for joining me today. How are you?
I'm doing good. Thanks for arranging this meeting.
Yeah, of course. So, we live in the Midwest, and how should people avoid slipping and falling during these winter months? I know that's something that could happen often. What do you suggest that people do to avoid some slips and falls and injuries?
Yeah, that's a great question. So we always talk to our patients, especially those who are prone for fractures, and that includes elderly population, ladies with other diagnoses such as osteoporosis. We tell them to make sure they have right kind of shoes that are not slippery, avoid heels in the winter time, especially on the frozen ice, and always make sure their gear is good. If they have instability of gait, we always recommend that they use a walker or a cane so they can avoid falls.
Is there something with, maybe falling on their backside versus trying to catch themselves? And what should someone do if they do fall?
Yes, I kind of try to think about the right kind. I don't think we have too much data about that, but ladies between 50 to 65 are at a higher risk of wrist fractures, and that's just because they tend to fall forward and all the weight goes on the wrist. If we can think in that fraction of a second, we should try to fall on all fours so all the weight doesn't go on the wrist because they're at highest risk for wrist fractures. Whereas elderly population above the age of 70, they're more prone to falling sideways and they end up breaking their femur neck, which is the hip bone, and that ends up requiring hip replacement and things like that.
Why is it that someone may be more prone to falling on their side when it comes to that age?
It kind of depends on their the lordosis and the kyphosis or the bending of the spine. And they're as they get older after the age of 50 and 60, our spine is a little more bent up, especially in the upper part. And the mechanics of falling is more that they kind of fall on the sides and end up breaking their hip, whereas younger adults may fall more on their wrist to prevent that breaking their other organs or preventing damage to other places, and they end up breaking their wrist more. So it's just very interesting to see that there is definitely been noted this kind of trend in falling. Best would be to try to catch on something and fall slowly on all fours if possible.
So if someone does fall, should they seek help to get back up? Should they attempt to get back up themselves? What is the best way about going about that?
The best way about going is to get help so that they can be stabilized. If they do end up getting a fracture and they try to bear more weight on that limb, it can make it more displaced and harder to treat. So best thing to do is if they can call some help right away, that would be great.
So what are some of the most common injuries that you see during this winter time from slips and falls? Is it mostly sprains? Is it breaks?
Sprains are definitely the most common injuries to ankles, and other things that are a little more serious are rib fractures that can present with a big bruise on their chest and just pain in that area, difficulty in breathing. So they need to go to their doctor and get an x-ray done to diagnose the rib fractures because it can compensate their breathing later on. And the most common fracture we see in 50 to 60-year-olds is the wrist fracture.
Sometimes even from just my own personal experience, when I have thought that I've sprained an ankle, I just tend to possibly walk it off. What are some things that people should do if they think that they might have sprained their ankle from falling or slipping?
It's a good idea to ice it right away if there is swelling in that area, and take Tylenol over the counter and calm that pain down. But if the pain is not getting better in the next day or two, it's a good idea to see your family doctor and get that evaluated, because there can be small hairline fractures in the feet that can be missed and they need to be treated early on.
So what kind of physical activities can somebody do to stay healthy and prevent falling? Are there any balancing techniques that you know of? What do you suggest?
Yes, that's a great question. So things we can do to prevent or delay osteoporosis is staying healthy, making sure we have a nutritious and balanced diet, including dairy products and sources of calcium. And then exercise, daily exercise for cardio is great, but strength training is a mainstay for osteoporosis. So if you want to make our bones stronger with exercise, it's weight-bearing exercises, even starting at small amounts like 3 to 5 pounds. 2 to 3 days a week is what we recommend. Training can be done with elastic bands too.
Are there any certain foods, vitamins, or supplements that can help make bones stronger for that exercise and to prevent falling accidents?
Yes, absolutely. So calcium and vitamin D are the most important minerals for our bones. And most of us require about 1,000 milligrams of calcium during the day, but it's best to get it out of our diet. So good sources of calcium are dairy products, green leafy vegetables, fish, meat, and this can easily be accessed online, but we have to try to make sure we get at least 3 to 4 servings of good calcium-rich food products. For vitamin D, living in Iowa, almost everybody is deficient in the winter time since it's a vitamin that's made under our skin from sunshine. So we need extra supplements during the winter time. Again, a good idea to have a baseline checked with your doctor so you know exactly how much of vitamin D you need. Vitamin D has been shown to cause increased risk of falls as well. It kind of begs the balance.
When it comes to bone health, how can people begin to take care of their bones to make sure that they are staying healthy especially when it comes to, keeping balance and preventing that type of injury?
Yes, prevention is always better than cure, especially when it's concerned with preventing fractures. So that's, again, a great point we should get across to our patients. People, if they're about 50 years of age, that itself makes their bones weaker with time. So being aware that the bones can be weaker and they might have osteoporosis is the first step. So we talk about who is at risk. It can be ladies about 50 years of age, people who have diabetes, chronic steroids, smokers, and that's really high on the list. People who smoked or drink heavy alcohol are more prone to breaking their bones as they fall.
Yeah, so what exactly is osteoporosis, and how can someone who may have osteoporosis or who may be concerned with that know more information?
Yeah, so they should go to their doctor, and if they have those risk factors and meet that criteria, they will get a bone density scan, which is a specialized X-ray. We do an X-ray of their spine and hip bone and then calculate how strong their bones are. So that's what diagnoses if they have osteoporosis. It's 3 categories. There could be normal bone density, osteopenia, which is borderline, and osteoporosis, which is definitely requires treatment.
So for people who have osteoporosis, what are some concerns with falling and how can they be more cautious around this time?
So the most important thing is to make sure you're wearing right kind of shoes and you know about your balance. So that can be assessed by your regular doctor. They can do some quick tests in the clinic itself and see if you have good balance or not. If you are at high risk of falls, it's important to use a walker or a cane, especially when you go out in the ice, and make sure your shoes are good. And falls can happen inside the house too. So we always recommend having rails in your shower so you can, take support and space. Same thing with walking upstairs or downstairs. Always use the railing on the side so you can avoid falls.
Outside of just in the wintertime, what are some common cases that you've seen where someone might have slipped and fallen, just whether was it walking, was it exercising or jogging, and how can someone be more cautious of overall when it's not even icy out, how to prevent that?
Yeah, that's another great question. It's important to know which patient or which person is susceptible to falling, and we can assess that for ourselves. So things that cause a person to fall are poor vision, for example. So if they are they're not up to date with their glasses number or their vision is poor, they'll be at high risk for falls. Long-standing diabetes makes people have autonomic neuropathy and their balance is off, so that can prone them to getting falls. Then certain medications can make people dizzy or lightheaded, so when they just get up and try to walk, they can fall down. So knowing that what your risk factors are, like certain medications, your neuropathy, balance issues at baseline, or if they've had a surgery of one limb and they are not balanced, all those things that make them more prone to fall, and they should just take their time when they get up and walk and just be aware that they want to cautiously prevent falls.
Is there anything else that you would like to add that people should know to prevent injury about slips and falls and just being cautious?
Yes, I would say that if you are at any of these risks, if you have any of these risk factors for increased injury or falls, you should get evaluated for osteoporosis, because falling may not always lead to a break in your bones, but if you have osteoporosis that's untreated or undiagnosed, you may have injuries that are way beyond the amount of or the severity of the fall. So it's important to get evaluated for osteoporosis. We can do DEXA scans in our office and treat you with the right kind of medication and calcium and vitamin D to make your bones stronger.
Perfect. Thank you so much for meeting with me today, Dr. Sharma. So I got some great information from you. It was lovely talking to you.
Yeah, same here. Thank you so much.